Give us a sense in Louisiana of where you stand with coronavirus. Do you have any cases that you're aware of? Have you had to deal with it yet?
Yes, so good morning. So in Louisiana, we have one case of the coronavirus that is being sent for confirmation to the CDC. This is a patient who was admitted to the VA Medical Center on Friday and initially was suspected to have pneumonia. Usually coronavirus causes symptoms that are lung-related, lung illnesses like pneumonia, was later found to have the coronavirus. And so right now, there are precautions that are being implemented for the individuals who cared for that person, as well as the contacts that they have. Right now, we don't have confirmation. We're waiting from the governor's office later today to talk about whether this was a case that was caused by travel or was this community spread. Community spread is when the virus is spread by contact person to person in local communities, not because someone went to Italy or South Korea or China or Iran, one of the epicenters of the epidemic.
And do you have protocols in place for health workers to screen at a very early stage? Because I've heard some stories where people deal with a patient for some time before they figure out it's coronavirus and they are exposed. Is there a way of early on screening out and say we have to take special caution with this patient because they may have coronavirus?
So I think it's really important to follow the guidance of public health professionals on testing. The CDC has an up-to-date website that talks about who should be tested. There have been communications by Vice President Pence as well as President Trump to say, anyone who gets tested, who wants to get tested can. We have plenty of kits. Those have been inaccurate communications. And it's really important that the professionals who understand what is the update on how many kits are available, who should be tested, are the ones that are giving these messages out. And in terms of who's being tested, CDC guidance is clear on who should be tested, those who have encountered an individual patient with these symptoms. And the period between exposure and symptoms can sometimes be as high as 14 days. So it's important that people can stay home if they've had exposure, and that's within 3 to 6 feet of someone who's had this. It's airborne. It can be through coughing or sneezing and so on. People who have been close to contact need to stay away from conditions where they're in contact with lots of people in large gatherings and so on. And that guidance is updated daily on the CDC website.